With over 200,000 people dead and more than 6 million people hospitalized, medical experts say there now be some hope in the fight against the coronavirus. Since the beginning of the pandemic, in January, hundreds of thousands of Americans have been affected, either personally or professionally. According to New York Times, right now there are over 40 million people seeking unemployment, with about a third of the population working from home. It adds, yet millions of others are considered essential workers, including nurses, grocery workers, doctors, food service, and public transit workers. So, what will it take for the United States to get back to some normalcy? There are currently 9 companies with clinical human trials working to create a COVID-19 vaccine, but some question how effective it will be and if it will be safe. Joining us now are Dr. Rick Hong, State Medical Director at Delaware Division of Public Health, and Mr. William Arthur, Certified Nursing Assistant at Bayhealth Hospital, to tell us more. Thank you guys for both joining us today. Dr. Hong, we are going to start with you. Will Delaware continue to follow the CDC protocols and distribute this vaccine to healthcare workers and other priority groups?
Yes, given the concern that the vaccine supply be limited initially, that we would like to work closely with our federal partners regarding how to prioritize vaccines. We do anticipate that CDC, as well as other federal organizations, will be prioritizing healthcare workers and other priority groups to be first in line for the vaccine.
Who is considered as the high priority groups in Delaware?
Healthcare workers are considered frontline workers and help keep our healthcare infrastructure running, so they are considered a priority group. We've also identified certain vulnerable populations. For example, long-term care residents and staff would be also considered priority. We are eagerly awaiting what CDC provides as guidance before we definitively determine what our priority groups are going to be.
Mr. Arthur, so how do you think the healthcare workers will respond to them being the first group to receive this new vaccine?
I believe that we definitely need to be in a fight to get this vaccine completed. Firsthand, I can definitely say a lot of us healthcare workers are not probably on the same page about being the first group to receive this newly developed vaccine. So there's a lot of questions I think that are left unanswered right now.
For both of you guys, if the healthcare workers do refuse to receive this vaccine, will there be other health protocols established in the hospital itself?
The vaccine, again, is just a piece to the puzzle, so to speak, for the response. Healthcare workers are not going to be, exempt from other infection control practices because they have the vaccine. Social distancing, use of protective equipment, or face covering, depending on the situation, and hand hygiene are key in this.
And Mr. Arthur, how about you?
But like you said, yeah, you have different options. Like everyone's entitled. You're allowed to take the vaccine. You're allowed to not. It's just really a matter of still instilling those same protocols. You're wearing your mask. You're gowning up. You're wearing your gloves, goggles, things like that. That's still going to be something that needs to be implemented because this is such a dangerous virus,
For Mr. Arthur, how are you and your coworkers currently treating this disease in hospitals since it's so new still?
So my unit was actually designated the COVID unit down in Milford, Delaware, Bayhealth Sussex campus. Since I want to say March, I will say I am very proud of how good our whole entire hospital, I think our whole company did in just assuming the assuming the position, stepping out on the front lines to protect everyone and take care of these patients with COVID-19. We're constantly protected. We had enough, we weren't really affected by that shortage. I mean, we you definitely see a change in your supplies and things like that, but Bayhealth definitely made sure to keep it in their best interest to make sure that we were still protected the entire time. So I think I would definitely give us an A+ for that. Safety is number one priority, and if your employees feel safe, then you can have better patient outcomes. So
is there anything else that you would like to add, Dr. Hong?
Also want to remind folks, as mentioned many times here, is that each of us has a role, which means that we need to uphold all the infection control practices.
Thank you both for joining us today. To learn more about the coronavirus and the potential vaccine information, visit coronavirus.delaware.gov or call 211 for further individual questions. And for those with hearing disabilities, text your zip code to 898-211.